So uh, today we have an interesting guest who is my master's thesis supervisor, Kristine Lin, Dr. Lin. And welcome to Pathology Podcast, Dr. Lin.
Thank you. Thank you so much for having me.
Thank you for accepting the request. So that I can talk a lot about school psychology, especially children, that I wanted to talk a lot previously in the prior episodes, but I couldn't because I was afraid that I would make some mistakes or talk wrong things. So here we have an opportunity to hear from a real expert.
I'm
So
very
I'm
excited.
super happy for that. Okay, so I have some questions and I want to start asking them. And
Sure.
so my my first question is actually I want you to introduce yourself and uh, yes, I just want you to introduce yourself.
Okay. So yes, I'm Kristine Lin. I'm originally from the US, so I worked as a school psychologist in the US for a couple of years. But now I am working in Taiwan as an assistant professor at Asia University in
Mhm.
psychology. Yes.
And uh, if I remember correctly, you used to work as a school counselor in one of the American high schools in New York. Is it correct?
No. So I did my training in New York. So when I was in
Ah,
graduate school, I was in graduate school in New York, and then I did do my
mhm.
externships in New York. So I worked in two elementary schools while there.
Ah, elementary schools.
However, so in the last year of my graduate program, in the last year of my doctorate program, I had to do a full-time internship. So I finished all of my coursework,
Mhm.
and then I worked in the schools full-time for a year to do my internship, and that was actually in Virginia. So I moved to
Ah,
Virginia to do
French.
my internship. Just because in the US there are not a lot of APA accredited internships that are in the
Mm,
schools. Usually they're in more clinical settings like private practices or hospitals or so forth. So this one was actually an APA accredited internship in the school setting. So I went to
mhm.
Virginia to do that, and while there, I was at a high school and also some middle schools and several elementary schools.
I see.
Yes, when I was working as a school psychologist after I graduated, I actually stayed in the same public school system, so in the same county in Virginia, and I continued to
Mhm.
work there for 2 years. And while I was there, I was in a middle school.
Okay, got it. So you have a very broad experience among children. Okay. Um, then what are the differences in school psychology and counseling between Taiwan and USA? Have you noticed any big differences?
Yes, so Taiwan doesn't have a school psychologist position.
Right.
So there is only one program in Taiwan that I'm aware of that has some school psychology training courses or some school psychology courses built into the curriculum. However, yeah, I believe there's only one. But again, there's
Mhm.
no school psychologist position in Taiwan. That doesn't exist. Usually, you're focusing on when you're studying psychology at the graduate level in Taiwan, you're usually focusing on either or specializing in either clinical psychology, counseling psychology, or maybe IO psychology, but
Mhm.
not school psychology, because again, that job position just doesn't exist in Taiwan. Whereas in the US, there's a lot of school psychologists. There are a lot of us. And
Yes.
so we also have a lot of school psychology training programs that are,
Mhm.
specific towards, for the field of school psychology. Yeah.
Okay. After hearing that, maybe uh, some of the Mongolian listeners might be wondering, "Whoa, Taiwan doesn't have any school psychologists as a profession," I think the reason why they might be interested is because recently we had launched educational psychology program among especially public schools, elementary and junior and high schools. And I think, if I remember correctly, some of the private schools have their own psychologists, not attending the government program. So that was going for around 2 and 3 years, and then recently we just launched a school psychologist mentor program, which is for guiding and supervising the school psychologists who are already working at their schools, and then try to I think just to supervise, like how to work effectively and efficiently. So that fact brings me to the question that I want to ask: what is the what is the point of having a school psychologist? Why does a country or a city or a school need to have a counselor or a school psychologist? Because in Mongolia we are starting to have it, but Taiwan, it doesn't have. But if we compare our economy and any other aspects, the Taiwan is higher than Mongolia in almost every aspect. So, what is the point of it? What do you think, Prof?
Okay, so that's a very good question. And I think it has to do with the way that the school system is set up in terms of the support. So for me to explain the importance of a school psychologist, I think I also need to explain how school psychologist works together with the other school staff. Because I think, you know, and again, I'm just speaking from my own experience when I was working in New York and Virginia. Every state is different. So I cannot attest to the way things run in other schools or in other states. But so when I was working in Virginia, for example, we had a school social worker. We also had school counselors and the school psychologist. So the school counselor is very different from a school psychologist. So that's an important but often misconstrued distinction. Many times, even when I'm in the US and people ask me, "Oh, what do you do?" And I say, "I'm a school psychologist." They're like, "Oh, you're a counselor." I'm like, "No, I'm not a counselor." Because the counselors actually study not counseling psychology, but they have a counseling program where they specifically study to become a counselor in the school. So it's different. But anyways, we work together as a team to address a variety of issues. So the school counselor will usually focus more on academic issues or like class scheduling, things like that. They might do some counseling, but it's usually much more brief or short term, whereas a school psychologist will usually take on more long term ish counseling cases, and will do is much more involved with more of kind of like the behavioral, or even sometimes not sometimes, but also the educational side of things. And I can talk about the many hats that school psychologists wear. So one part of the job that school psychologists do that is often seen is maybe sometimes thought as the only thing that we do, but it's not the only thing we do, is testing. So we do a lot of testing, right, to determine if a child qualifies for special education services or not. And that is also a team effort. So depending on the state that you live in, a school psychologist will do the psychological evaluation, which encompasses the intellectual assessment, like IQ, if you will, the intellectual assessment, and as well as the social emotional functioning assessment. And then there's actually another person called the educational diagnostician, who does the educational assessment. But in New York, for example, there is no position of an educational diagnostician, so the school psychologist will do all three components of that evaluation. And there's a lot that goes into all of those components. So yes, the school psychologist will take part in the testing to determine whether a student qualifies for special education services. But not only that, school psychologists will also do an evaluation to determine if a child qualifies for 504 services. So 504 is not necessarily special, it doesn't rise to the level of special education, but usually a student will have some sort of diagnosis in which they require maybe some accommodations. There's also something else called child study, which is kind of in a lower tier of interventions and accommodations, and the school psychologist will also take part in those meetings to also support students and their teachers. So that's the kind of a brief overview of the assessment portion. And then there's other things where we, as I mentioned before, we do counseling. So if any of the students need counseling for whatever the presenting problem is, the psychologist can meet with students. School psychologists also do behavioral interventions. So maybe there's an issue that's occurring in the school with a particular student, and then the psychologist can intervene and actually implement some behavior plans, and also do the assessment for that too, because doing a behavior intervention plan also has a lot of things that you need to do in order to design the intervention. There's also consultation. So sometimes if teachers are struggling with a specific student, whether it be an academic issue or whether it be a behavioral issue, school psychologists can also act as consultants, where maybe we design a behavior intervention plan, but we're not the ones that are actually implementing it and directly with the student. Actually, maybe it's the teacher that's implementing it, but the school psychologist is the one who is designing the intervention, constantly consulting with the teacher, collecting data to make sure that the intervention plan is working, and then making any adjustments as necessary. So they can work as consultants to teachers, but and also parents as well. So that's another piece that school psychologists, that's another role or a hat that school psychologists wear. There's also crisis intervention. So if there are any crises that happen in the building, let's say, unfortunately, there's a school shooting or there's a death of a student or a faculty member in the building, school psychologists will also go to address any crises that happen in the school. Or if there's some sort of natural disaster. So there's that. And then, so actually, you can work on that in your own school building. The way that my district in Virginia worked was we actually had a team. So the school district that I worked for was actually quite large. So if there was a crisis, for example, there was a crisis where a student had passed away, not in the school buildings, but anyways, the student had passed away. And so we're all assigned to different sections of the county. And so then the crisis intervention team assigned to that particular area in the county, we all gathered. And the crisis intervention team what consisted of school psychologists as well as social workers, and sometimes some of the student assistance specialists. So we all got together to make sure there was enough support in that particular school building to talk to both to provide crisis counseling for students and the teachers. So that's another thing. And then school psychologists also do more like broad interventions, maybe preventative services like anti-bullying or anti-drug or some sort of or mental health interventions. Some school psychologists will do like mental health awareness week, and then they'll plan all these activities, for the school to address mental health and improve mental health amongst the students, and also just work towards improving the overall school climate as well. So there's a lot of different things that school psychologists do, and the role of the school psychologist will also differ depending on what school you're in, what level you work at, and also maybe the needs of that particular school. So there might be some schools where you're mostly doing testing, or there might be some schools where you're mostly doing counseling and intervention. It really just depends on the needs of the school. Yeah, it's a very long answer to your question. Yes.
But it shows that the real importance of having a school psychologist at this school. Because when I was in high school and when I was in school, I didn't have any psychologist or a counselor, and I needed to overcome every family stresses and struggles with my own heart.
Mm. I think
Yeah, so
that's a really good point because a lot of
mhm,
times when people think of schools, they just think of the academic side. But if a
mm,
child's emotional needs are not being met, right, how can you expect them to be able to function and perform well in school if there's all these other issues that are happening in the background and you're just kind of ignoring them? You can't ignore them, right? So
right.
it's very important to make sure that all the students' needs are being met, and even their basic needs. For example, making sure that they have
Mhm,
enough food, that they have clothes to wear to school, and yeah. So that's just it's all these other pieces that sometimes people don't necessarily think of. But that's why it's
mhm,
really important that we have mental health specialists in the school buildings.
right. And now, when I think back to my school years, I think that I have lost many years without feeling enough happiness or enough just calmness. I spent a lot of days and years just worrying about a future and stressing about the family problems and maybe friendship problems. So I'm assuming or concluding that the school psychologist is there to help children to overcome every struggles and issues or troubles, psychological, especially
Mhm.
mental problems. Okay, so got it. Then the program that has started in Mongolia is actually called, if I translate from Mongolian to English, it's called educational psychology, not school psychology. But what we are doing is actually a school psychology program that we are preparing some school psychologists, and the government or the Mongolian Psychological Association is sending uh, those people to the schools. But in English or in America or Western countries, I believe actually every other nations are same. The school psychology and educational psychology is actually different, right? So could you explain
Mhm.
what is the difference between these two terms or fields?
Yes. So educational psychologists focus more on curriculum design. They are more focused on the teaching aspect. I guess what
Hmm.
kind of teaching strategies will be more helpful or most helpful for students? How can you improve student learning? So it's more focused on kind of research, design, analysis, that kind of work that's related to education. School psychologists, again, are more, well, I mean, you can be a researcher, but more often than not, a school psychologist is someone who's actually working in the school building, and is doing interventions and working directly with the students, doing testing and all those things that I had just described before. So they do sound, educational psychology and school psychology, they sound like the same thing, but they're not. They're two different
Hmm.
things. Yes, but I mean, it is
Hmm.
all related to education.
Right.
Mhm.
Got it. Okay. Then my next question is, what are the minimum qualifications to be a school psychologist in the USA? What did you sacrifice or do to become who you are?
Well, actually, so in order to become a school psychologist, to work in the school building, you you need a master's, at least a master's degree.
Mm.
You don't A doctoral degree is actually not required to work as a school
Oh, I
psychologist in the
see.
school setting. Um, all the licensing requirements and everything for psychologists, it differs depending on the state. But anyways, you need at minimum a master's degree, and then you
Mm.
can get a cert. I guess it's a license, to work as a school psychologist in a school building, and that's usually you would apply for that through the Board of Education for that state.
Mhm.
It's either a certification or a license. The terminology, it all differs depending on which state you're in. But if when you're licensed in that state, you have to work in that state. But of course, if you move, you can always, um, apply for licensure in another state for working in the school setting. Again, that's through the Board of Education for that state. For me, I got my doctoral degree so that I could also become a licensed clinical psychologist. So that, I mean, even the requirements to become a licensed clinical psychologist also differs depending on the state that you work in. So it's a little bit complicated. But by getting my license clinical or my clinical psychologist license, that allows me to work outside of the school setting. So if I have my master's and I'm able to work in the schools, I can only work in the schools. But by getting my doctoral degree and by getting my license, well, actually, you don't even have to have a doctoral degree. Well, anyways, it again depends on the state. But by getting my clinical psychology license, I'm able to work in settings outside the school. So if I wanted to work in private practice, I could do that, or in a hospital, I could do that. But again, you're licensed. When you get your license, your license is for a specific state. So if you wanted to get your license in another state, so for example, I'm licensed in the state of Virginia. If I wanted to work in New York, I would actually need to apply for licensure in New York. And actually, even the title of the license is different. So I am licensed as a clinical psychologist in the state of Virginia. If I applied for my license in New York, I would apply for a psychologist license. They don't call it clinical psychologist license. So everything is very, yeah, it's very confusing. But yeah, so I hope that answers your question.
So when I think about this, I think I wonder what people think about these qualifications. Like in Mongolia, we actually don't have any. I mean, we have, but the qualification is quite, the standard or the minimum is quite low. So anyone who studied bachelor in psychology can actually work as a school psychologist if they can fulfill a certain courses or a certain amount of practices, additional practices. What is the reason for these many years of studying? Why do you think the US or the states have this higher minimum standards or qualifications requirements?
Well, I think it's to make sure that the psychologists that are actually out there and in the field are actually qualified and have the appropriate training in order to effectively do their jobs, right? Because you're working with kids. This is a very vulnerable population. And as I had, when I was, mentioning before, I was describing the role of a psychologist, there's a lot of different things that we do, and they all require a lot of different skill sets and a lot of training. So I think it's important that when we have people working in the field, especially when you're working with such vulnerable populations, it's important to make sure that we have the appropriate training. Because if you're not providing the appropriate training, and then you're sending these people to work with children, you can have a disaster on your hands, and that can have really very, very serious ramifications. So I think, yes, it's very. I'm really glad that we have these requirements in order to be able to work where we work and to be able to work in the schools. I think it's a privilege to be able to work in the schools, but it's also important that we know what we're doing. Yeah.
Right.
Mhm.
I feel like it's not so much different from being a medical doctor. Maybe medical doctors are more more focused on the biological and physical thing, but the same as the physical body, the mental health is a very, I think, for me, it seems very fragile thing that you can actually go down a hole that has no end or limit, and then you can go down and down.
The
Okay,
human psyche is an
then
interesting thing.
yes, right. Then you mentioned that the children are a very vulnerable group. Then what was your hardest case when you were working as a school psychologist?
Um, hmm. That's a great question. I think, well, when I think of my hardest like counseling case, I actually think of a case that I had before I was working in the schools, but I was working in a community
Mm,
setting. Um, for me, the cases that tend to be the most difficult are the cases um, where suicidality is involved. So I had a an adolescent client who was frequently engaging in self harm and some suicidal attempts, and I think that those kinds of cases are particularly difficult for me because, I mean, you have someone's life at stake, and I think that can be very difficult to deal with emotionally as well. It's very when you're constantly worried about a client. I mean, granted, I was also pretty new to the field at that time, but
mhm,
I think those kinds of cases are really difficult for me because I also will kind of hold that those emotions with me. And that the client ended up being okay, but it's, when you have a client that's in and out of the hospital, in and out of inpatient units for suicidal behavior, and then working together with the family. I mean, the client and I had a great relationship, and but it's very difficult to deal with and hold on to, or kind of have those emotions myself as the
mhm,
psychologist, because it's just a very heavy subject matter. So working with clients who have suicidal behaviors or suicidal ideation is not my cup of tea because I think it's difficult for me to deal with myself because I oftentimes will hold on to those emotions. Um,
right.
so yes, that's what I would say is usually in terms of counseling is the most difficult for me.
Mhm. Okay. And if I heard correctly, you said that this is when you were actually studying, right?
Yeah.
Mm.
Yeah,
And
we have.
during that time, where did you get any help or any supervising?
Oh, yeah. So we had supervisors who were licensed psychologists. So this was when I was in New York. So we had
Mm,
supervisors who were practicing and licensed psychologists in the state of New York. So I was getting supervision, um,
mhm,
you know, throughout the whole case, but it was still very difficult to deal with, and that's when I knew that if
mhm,
I could help it, I would not want to work with um, kids that have very serious suicidal ideation. Um,
mhm,
but I mean, that was a particularly hard case. Um, yeah.
mhm. Got it. Since we've started talking about suicidal ideation and behaviors, uh, I noticed some parents are actually quite harsh when they find out that their kid or children have some of these behaviors or ideation, and then they get very angry, and maybe they want to prevent it, but then the solution for the parents turns out to be punishment or some kind of harassment. So what would you suggest for the parents maybe who are listening to these podcasts, uh, in terms of how to deal with the children who have those issues?
Yes. If I had to give some advice to parents who have children who are maybe suffering from depression or engage in a non-suicidal self-injury or suicidal ideation, just if your child is not receiving mental health services, to definitely seek mental health services as soon as possible. And also, when there is a child that is dealing with these very serious issues or these very difficult issues, it of course will affect the family as well. So parents can also benefit from receiving mental health services themselves to help them manage and cope through this kind of situation, but also by working with a mental health professional, such as a psychologist, they can help to provide strategies for parents to not only cope and deal with their own emotions, but also to help guide them in terms of interactions with their child, right? What is maybe a more appropriate way to respond to a child's behavior behavior? Or what is a more appropriate way to respond to a child when you have found that they've been engaging in non-suicidal self-injury? How can you, instead of just punishing, right? How can you respond to them that's appropriate? Or also, how can you change the way you interact with your child to prevent, right? To prevent continued non-suicidal self-injury from happening. What are the steps that you can take to make sure that the house is safe and doesn't have sharp objects? Or how can you be more, maybe try to change the climate within the household to be more supportive of the child? So there's a lot of different things that can be done. So I would say to definitely seek the help of a mental health professional.
Mhm.
Yes.
Got it. And also, I want to ask about the techniques that you have been using or you had used when you were working as a school psychologist, especially with the kids who have the suicidal ideation or behaviors or self-injuries. And what do you think the best technique for you or for the kids or in general? Or do we even have a thing like best technique?
I think that really depends on the case. Every case is
Mhm.
nuanced. It's all these cases are very different. All the cases are very different, and the kind of the root cause, or maybe some of the things that contribute to the non-suicidal self-injury or the suicidal ideation can. I mean, again, it depends on the case. So it can be coming
Mhm.
from very varying reasons. So I think it really depends. But something that is some evidence-based therapy that has been shown by research to work well to be helpful for um, those who are engaging in suicidal behaviors. And again, everything's very nuanced, depends on the case, right? So your techniques or even your approach may be wildly different depending on what exactly it is going on with the child, right? It could be depression, it could be some other sort of mental health issue.
Mhm.
So again, nuanced. But DBT, which you have learned about
Mm.
when you were in your
Yes,
master's
indeed.
program, right? Dialectical behavior therapy. So so it was originally designed for adults, but there's also DBT for adolescents. And so if
Mhm.
you get the DBT for adolescents book, it actually has all of the worksheets and all the handouts and everything that's more tailored towards a younger target, younger client. So back when I was working in the schools and also in the clinical settings, um, and when I was working with children who were engaging in either non-suicidal self-injury or suicidal ideation, or even sometimes just severe anxiety, I would pull out some of those the skills from DBT and some of those worksheets and handouts, and work on some of those skills with the kids.
Mhm. Got it. Now I think that the the factors that's making this case or this kind of situation very nuanced are maybe some of the causal factors like the depression or the stresses or the trauma. And then I'm also thinking that any other kind of factors could be uh, the counselor or psychologist related. Maybe the psychologist is from another country and who didn't grow up or was born in the the country that he's working or she's working. Do you think can someone uh, do you think can someone work in a foreign country or culture as a school psychologist, or do you think they should have at least uh, an in-deep knowledge of that culture, or that person should at least live 5 or 6 years prior to starting work? Or is it possible for anyone can work in another country as a school psychologist?
That's another great question. I think I do think that school psychologists can work abroad. Um,
Mm.
Multicultural competence is something that's really important to consider when you're working as a psychologist, whether you're working as a school psychologist or a clinical psychologist, a counseling psychologist, whatever it might be. Multicultural competence is very important. And this could also apply, with the U.S., for example. I can really only speak about the U.S. because I'm from there, but in the U.S., right, the U.S. is very diverse. So even working in the US, you might lack some multicultural competence when you're working with clients from certain ethnic backgrounds, right? So then you'd need to consult another professional, or you'd have to do some more research so you can learn more to familiarize yourself with that culture. Or you might need to refer to someone else who's more culturally competent with whatever that client's demographic may be. But because different areas within the US are very different ethnically or culturally, or whatever it may be. That can also go beyond just ethnicity. But yeah, so even working abroad, and when you're working abroad, there actually are a lot of school psychologists who work abroad at international schools, for example. Like, there's a lot of American international schools or European international schools. So then your the student demographic will be very different. You're in a foreign country, but the demographic in that particular international school is probably going to be very different from outside the doors of that school, right? So but it is really important to make sure that you are culturally competent. So if you are living in a country, and let's say you are working in a school setting where there are more, regardless of whatever the kind of that cultural background of that student population is, if you're working with a student population that you're not necessarily familiar with, you definitely need to do some research and or consult with other professionals to better educate yourself, because you could be making a lot of mistakes if you're working with a client population that you're not familiar. If you're not familiar with their cultural background, there's going to be a lack of understanding there. There's also things when you're interacting with the parents, for example, you might be engaging in cultural faux pas, right? You might do something that's very offensive, right? And that happens when anyone's just traveling abroad naturally anyways, right? There's lots of those like videos on YouTube. They're like the 10 top things not to do in this country, right? Because it's so offensive. So you have to think about, when you're working in a professional setting, there's a lot of things someone's culture, since we're talking about culture, right? Someone's culture is a part of their identity. So if you don't understand that, and you don't understand how that may be related to to psychology, or how psychology is viewed, how mental health is viewed in that culture, you could be doing more harm than good, right? And if anything, you should not do harm, right? When you're working as a mental health professional or any sort of health professional. So that's something that you really need to educate yourself on before you decide to work with a different population.
Got it. I hope that gave some motivation to the psychologists who want to work, or who try to work abroad. I remember one of my friends asked about that, actually, and then she was wondering, is it possible to work in Taiwan as a school psychologist, even though she was born and raised and studied in Mongolia. And then during the time, I didn't have very clear and concise answer. So
there are
I'll definitely
international
send
schools
the link.
here. So
yes, right?
yes. Not all of them have a school psychologist, but some of them do. Yes.
Got it. Okay. Recently, Taiwan has launched a program for university and high school. I think junior and elementary schools are also included in the program, that the government allow students to have up to 5 days of mental health break during almost any time in the semester. And if that break happens to be on the exam date, the teachers should schedule another date for the re-examination. And this brought me one of my memory that was that wasn't very pleasant. I had a rough when I was in high school. I needed to take an exam on a day, but on the previous day, I had a quite rough night, not because I went into some kind of trouble, but it was brought to me by my family members. And then I had no option, no other choice to just face and sleep on it. And then in the morning, I asked my teacher to have my exam rescheduled, but she told me to learn to handle your life or learn to control your life. But I was a high school student, like I didn't have any life actually. I was dependent on my parents and my family members. And then there, at the time, I had uh, nothing to say, and then I just went on to my exam, and I did very poorly. So for me, when I see this news from a student perspective, I see that, oh, this is wonderful implementation. But what do you think as a school psychologist? Do you think this is actually do you think this could be actually beneficial, or do you think this will make more job for the professors and the teachers? Also, as a university professor, you can answer this from that perspective.
Yes, I think my perspective is definitely mixed. It's a mix. I'm mixing in my two,
Right.
my two professional backgrounds here. No, I do think that mental health days can be very useful and very valuable because I mean, naturally, as human beings, we can be overwhelmed for a variety of reasons, right? Maybe there are external factors, right? And in your case, there was some sort of family emergency that happened, right? That prevented you from being able to adequately prepare for your exam, and it was maybe you didn't get enough sleep, and then you come to the exam and you're like, I'm just so overwhelmed, right? um
Mm,
and so it's things like that, or students who do have very severe mental health issues, or it doesn't even have to be that. Just sometimes we, as typical functioning human beings, will sometimes feel very overwhelmed for a variety of reasons, or have whatever kind of maybe more extreme emotions for, whatever that may look like for ourselves. And sometimes we just need a break. And, as adults, as
mm,
working adults, that happens as well, right? And we just need to take a day to reset and relax and just refocus ourselves emotionally and physically and mentally, everything, right? And so I do think that having mental health days has its place, and it can be very beneficial for people. I think because we do tend to be in this culture, where there's this culture, where work tends to be prioritized over everything. I don't know if that's
mm,
an American thing, or um, or what, but it's just, unless you're absolutely dying, you should be, responding to your work emails immediately, or you should always be on the ball, and or as a student, you should always be on top of everything. But it can be overwhelming, and especially when you're a student, right? You're learning how to deal with stress, you're
mm,
learning how to cope, you're learning how to balance studying, and balance, studying with extracurriculars and dealing with family things and everything. So I do think that having the mental health days can be really beneficial for students. Now, on the flip side, it becomes a problem if people take advantage of it and use it as a crutch,
mm,
right?
mm,
Let's say, when you're a high school student or a middle school student, you're learning time management skills, right? And how to prepare for an upcoming exam, or work on a large project, right, that is due. And sometimes, or many times, students will choose to wait until the night before to start studying, or to even start working on the project. And then they realize that they've run out of time and it's not possible to pass that assignment, right, or that test, because they did not adequately prepare. And so then they may request for that exam or the project due date to be postponed. And it's okay if it happens once or twice, okay. But if it becomes a habit, because you're allowed this
mm,
flexibility, right? If it becomes a habit, then you're never going to really learn your time management your time management skills, right? And you're not maybe going to really develop those appropriate study skills, right? Because you're using these extended deadlines or this mental health day to get an extended deadline as a crutch, right? And when you're working out in the real world, you don't get that anymore, right?
Mm,
So I do think that having these mental health days can be very helpful and beneficial for people as long as they're not taking advantage of it, because when that happens, it actually does them a disservice rather than service. Yes.
got it. Now, when you mentioned that the children, the school kids are learning how to handle the stresses and the emotional aspects of their life, I was thinking about some ethical parts of life that also as a kid, as a student, we learn how to be ethical and how to live in a society as an ethical person, right? Because without ethics, there's going to be a dystopia. So, uh, when you were working as a school psychologist, did you uh, was there anything that you specifically do to improve the students' ethical sense, if I can say ethical sense, or maybe improve the ethics?
You mean
What
ethics
if
related?
yes, in general, like what if the kids are stealing, or what if the kids are telling lies, like when you said that if the student starts to gain uh like use the up to 5 day mental health break in a wrong way, right? So what if they start to actually do that, or what if the students are start to tell lie a lot of the times, or maybe cheat in the classroom?
Mhm, mhm. So I think the type of response depends on the behavior, right? So you had mentioned
Mhm.
if the child is displaying a pattern of taking advantage of the mental
Pattern.
health days, right? A pattern, if you're noticing a pattern of behavior where they're only taking their mental health days on all of the midterm exam days or all of the final exam days or something like
Mm,
that, then and maybe the teachers are coming to you like, I'm noticing that Johnny is only taking, always postponing the midterm exams, and you're noticing this across maybe all of their classes. Um, and so that's when you can do something like a consultation. That could be a consultation case, right? So maybe, and again, as I mentioned, I think the beginning of our conversation, school psychologists oftentimes will work with a team, right? So we might meet together with the school counselor and the parents and maybe some teachers and
mm,
work as a team together to discuss about this particular issue and how can we address it, and
mm,
how can we maybe start to, yeah, how to address the whole time management issue, not by just punishing them and say you can't take, you can't take the mental health day on the exam days, right? That in itself doesn't solve the problem. It doesn't actually address the issue, right? The issue is maybe that the child is maybe avoiding, or because they think it's too hard, right? And so they're avoiding the exam, or maybe they really do need help with time management skills. Maybe they are trying really hard to study, but they don't actually have adequate study skills yet. So maybe we need to suggest to the parents that they hire a tutor, and the tutor can help that child with developing better study skills and study habits, right? So that's just an example. So there's different ways
mhm,
that you can address that. Things like lying and stealing. I mean, with lying, I think it really depends on what it is. If it's some very significant lying where it's threatening the safety or something, then that's something you'd have to address. I mean, it really depends on what's going on with the lying. There might
mhm,
be just administrative disciplinary action that needs to be made, like stealing, for example. That is something that would have administrative disciplinary action in response. So whatever the school's policies are. Um, and then maybe there could be something else going on. Maybe the child is stealing because they don't have food at home and they're stealing snacks from the other students' lockers or something because they don't have food, right? It can be much more complicated than just Sally's stealing. Right, so you need to figure out what might be contributing to that. And then you can work together with the school-based team to address whatever that issue is.
See, got it. So always look deeper.
Yes.
Got it. Okay. The next question is also about the years that you were working as a school psychologist. What kind of interventions or preventions did your school conduct to keep students away from drugs, alcohols, and any other substances? Could you give
Yes.
us detailed explanations?
Sure. So I was very fortunate that the school district or the county that I worked for, we had a lot of support, a lot of professionals that provided support for students. So we actually had a position called the Student Assistance Specialist, and they provided what's called student assistance services. And so they actually, we call them SASs for short. So the SAS, there would be one SAS that would be assigned to several schools, and they would actually come in, and their main focus was to work on addressing issues such as drugs, vaping. Vaping was a huge issue. Bullying. A lot of different issues that were happening that were becoming more and more pronounced in the county and also across the country. And so they did a lot of like presentations, like anti-drug presentations. Also, they would present not only to students, but they would also present to teachers, administrators, other mental health professionals that worked in the school buildings to keep us also updated on the latest research. Like, for example, when I was working in the schools, vaping was starting to become very popular, and vaping and a lot of kids thought vaping is better than cigarettes, but actually it's not, right? It's just as harmful, and all these chemicals, you don't know what you're inhaling, right? So, but all of the updated information, the research about vaping and the harm and what to look for too, in terms of what kinds of behavior students might engage in to hide their vaping in the schools, or cigarette smoking, whatever it might be, or other illicit drug use. It was actually their jobs to educate us and keep us updated to let us know, here's the statistics. This is what's going on in the state. This is what's going on in the country, right? These are rising issues, and then how we could address them. But they would also, so then we would know, and then, they would also provide services so if there was a student who was caught, let's say, doing drugs in the school bathroom, right? Then the SAS would actually meet and work directly with the students. So I actually didn't have, when I was working in Virginia, I actually didn't have as much to do with the drugs and the, those kinds of issues, because we had the SASs, and they were great.
Okay, got it. The next question was actually about bullying, but you have already mentioned this, so I assume also you didn't do much about reducing bullying or any kind of shaming, maybe body shaming or discrimination in the classroom.
No, so we did. So when it came to bullying, I mean, if there were specific incidents that were happening, then we'd have to, work with the kids involved, the students who were involved. And so if there was if there were bullying incidents, we might do something called restorative practices, which is it's this whole process that you go through it's like a process of healing when you're addressing incidents or conflicts that come up between students, and you're also involving their parents and anyone else who might be involved. So we did take part in the restorative practices. And then there's something else. We also did preventative work too. So when I was working in the middle school, I was involved. I worked together with the school social worker, and we led a program called Sources of Strength. So Sources of Strength was not created within our district. This is this was a program that was implemented, that being implemented in many states across the US. And it's actually more of like an anti-suicide, it's a suicide prevention program, but it's focused on changing the school climate. So this is an example of one of the school-wide programs that I had mentioned earlier, where it's actually a student-led program. Student-led in that you actually can have teachers recommend or students volunteer to become the sources of strength leaders, and then you'll have these sources of strength meetings where the students actually come together. And the school social worker and we are more facilitators, but we really let the students come up with different ideas in terms of how can we improve the school climate, because when you're improving the school climate to become more safe, more positive, more supportive, right? When you have that kind of school environment, that the effects of that will trickle down, right? You may have less depression, less anxiety, less suicidal behaviors, incidents of suicide, right? Because you're in an environment that's much more supportive and positive. So they did a lot of, and that contributes to bullying as well, right? Because school climate really affects, I think a lot of people don't think about school climate when they're thinking about problem behaviors in the school, but school climate also contributes to problematic behaviors as well as positive behaviors. So sources of strength, the students would plan and design all of these different activities for the school to do. So it'd be for all the students in the building. Like for example, we had it was like a thankfulness tree that we put in the building. I can't remember. I feel like we made a pun out of it, but I don't remember the name. Where all the students, they had a different color piece of construction paper. They cut it out in the shape of their hand. So each piece would look like a leaf, right? So we had the fake, we cut out brown construction paper to look like a tree trunk, and we taped it to the wall right outside the cafeteria because that's where all the students will pass by at some point in the day. And then each student would write what they're thankful for or what they're grateful for. And then they don't put their names on it or anything, but then they would stick it on the wall. And then it would just be all of the leaves that have, and so things like that. We would do a lot of different things like that. And it was a lot of fun for the students. And so that's, even though it's presented as a suicide prevention program, it really is a school. It really does improve the school climate. And that's the point, but it has other positive ramifications as well. Yeah.
Got it. I didn't actually think from that point of view. And when you were talking about the school climate, I just remember that a few years ago when I was studying at National University of Mongolia, our department worked with psychology department of Western Washington University, and we worked on translating and adapting what's happening in the school scale into Mongolian language among, I remember it was high school and junior high school students. So if any psychologists were working in Mongolia, they can actually use this scale to measure the school climate at their schools. I just wanted to mention that.
I think it's tools like this that can be really important because, again, I think people oftentimes oversee, or they overlook things like school climate because it doesn't necessarily always occur to them that that's something that can be a very important contributing factor, right?
Right.
Yeah. And so then it's programs. That's something that I really appreciated about Sources of Strength, because it was very focused on improving school climate and focusing on the strength, right? It's called Sources of Strength. So for focusing on the strengths of the students rather than everything negative. Because if you also think about a lot of times programming, like sometimes if you have like mental health week, awareness weeks and stuff like that, the programming is like, what happens if you do drugs, right? These are all the negative
Mm,
things that can happen to you, right? And just focusing on all the bad and the negative impacts of everything that you can do, and that happens when someone decides to commit suicide, or someone decides to engage in using illicit drugs or whatever it might be. And so instead of just, and then, or like, oh, this is what happens when with anxiety and the dangers of not seeking help. Okay, but you can do that, but are presentations like that to students really that helpful? Or is there another way to address these things directly instead of just constantly telling all the students, here's all the bad things about all these things, about
mm.
all these issues, right? How can we actually change students' perspectives, right? And well, this is where maybe positive psychology comes into play, right? Where you're changing
Yes, I
people's
was actually
perspective
thinking
and
that.
focusing on their strengths, right? Looking at the strengths of others, but also your own, and reflecting on that. Because I think oftentimes we're constantly trying to focus on how can we improve ourselves, so then we're always focused on what we lack, right? But if we focus on also, okay, here are some of the strengths that I have, and here are some of the things that also help me when I am struggling, right? That can also help to improve one's own self-esteem as well, right? So yeah.
Thank you. Thank you so much, Prof. Uh, as the last question, I want to ask you about a psychological uh, counseling techniques. Like as I learned from my courses, that recently the the research suggests that actually the most important part of a counseling or a um, psychological counseling is not about the techniques, but about the relationship between the therapist or psychologist and the client, right? And could you explain this a little bit and uh, give us some idea why is it more important to have a good relationship than to have a best evidence-based practice?
So this topic is very controversial.
It is.
Yes, it's a very controversial topic. For me personally, I do
Mhm.
believe that, and so you're referring to common factors, right? And
Right.
for me personally, I don't necessarily believe that that things such as the common factor, or the relationship between the client and the therapist, is necessarily more important than the technique, because I do
Mm,
think that the technique is very important. So there are people that believe that the technique doesn't really matter. It's just the relation, like these common factors that matter. I think they all matter. Um, I think that they're all
mm,
important, that they all work together, right, to improve client outcomes. So yes, we taught when you were taking that course, we talked about things that are related to the relationship between the client and therapist, right? Making sure that the client feels comfortable with the therapist, right? Or and that there's a trusting relationship between the therapist. The therapist is not trustworthy, right? It's going to affect how much a client is willing to share or divulge with the therapist. And if the client doesn't feel comfortable being vulnerable with the therapist, right, that's going to be really hard then for the therapist to make um, and a good assessment of what may be going on with the client, and also then how it will then impact the intervention outcomes or the treatment outcomes, right? Let's say that for example, let's say that a therapist has presented a treatment plan for like a behaviorally based, or it doesn't even have to be, but let's just say a behaviorally based treatment plan. And so this client has homework assignments that they're supposed to do. So maybe they're supposed to practice some sort of skill outside of the session, and then they report back on the outcomes of their skills practice or their skills application, right? If the client is afraid or doesn't feel comfortable with the therapist, right? Maybe they might kind of fudge their response or fudge their
Mhm.
report of how it actually went, right? Maybe they'll say, oh, it really worked well. And then kind of, because they're afraid of judgment or whatever it might be, then that's going to impact the actual true treatment outcomes, right? Because that means that it's actually not working as well as it should. The treatment is not working as well as it should be because it's not being implemented with fidelity and you're not actually getting accurate information, right? Because a part of when a therapist is implementing an intervention, part of that is also progress monitoring. Monitoring is really important because it tells you or tells the therapist and also the client how well a treatment is actually working. And if it's not working that well, then that notifies the therapist, okay, we're not really where we're supposed to be at just yet. Let's figure out why that's happening and address those issues and modify the treatment so that it can work better and we can have better outcomes. But again, if that trust isn't there, then that's going to affect the outcome of the treatment, and it's not going to help the client as well, which the whole point, right, of therapy is to be able to help the client improve their functioning in whatever area they're focusing on. But that's why it's very important that there's a fit. And sometimes it may not necessarily be the fault of the therapist or the fault of the client. Like, for example, you can have a very skilled therapist, but some people just don't click. And that's okay,
Mhm.
right? And therapists also need to recognize that as well. And when that happens, right, the therapists themselves can be very, very skilled in whatever that target area is for that presenting problem, or even it could be sometimes cultural differences, right? Some people from certain cultural backgrounds might feel more comfortable having a therapist that is of the same background or ethnic background as them because they feel that there's going to be more of a cultural understanding there because there's some maybe shared cultural experiences, and that's fine. Or even if you think about like the LGBTQIA plus community, right? That you might want to have someone who's from that same community because they'll have a better understanding of maybe your own personal experience or just a better understanding of that culture and also the culture of that community. So if you there can be various, and again, that has nothing to do with the skill level or how good a therapist is at working with clients. Sometimes it's really just like either personalities, cultural backgrounds, or expertise backgrounds, whatever it might be, that could contribute to maybe this isn't a good fit, and that's okay. And then if that does happen, right, then the client or the therapist will be responsible for referring the client out to other therapists who might, you know, be of that same ethnicity that the client is looking for, or just someone else that might be a better fit for that client's needs, and that's okay. But yeah, the relationship between the therapist and the client is very, very important.
Mhm.
Yes.
Okay. So that's everything I've prepared to ask you. And thank you for sharing a lot with us. Actually, this was like one of the classes from my master's program.
You just hear me
Like,
lecture.
yes, even I learned a lot again.
I'm glad. Thank you so much for having me.
Thank you, Prof. Thank you, Dr. Lin. And I think we should end here because our time is actually more than 1 hour, and usually our listeners actually stop listening from 30 to 40 minutes.
Yes.
But because of having you, I think they will finish.
I hope so. Or take a break and come back.
Oh yes, right? Because it has a lot to learn.
All right. Well, thank you so much for having me.